Today's topic is minimally invasive spine fusion. Welcome back to the channel. Dr. Edward Rubin, pain management specialist, here to go over with you the MinuteMan Procedure, which is a minimally invasive spine fusion product. Interesting approach here. Rather than going directly from behind, it's actually a lateral approach. So you make a small incision about an inch on the patient's flank, and then you aim a guide wire to the level that's being fused. In this case, it's typically the procedure that you would do probably around step 3 or step 4 after you've tried epidurals and other less invasive procedures. Anytime I'm placing hardware in someone, I always want to make sure that they've had a chance to get a surgical consult and make sure that there are other options that have been presented to them, because once you place this in the spine, it's challenging to remove and it will be in the way if you decide you want to do a traditional surgical approach. What is very nice about this approach is you see the dilators being placed there. Those dilators essentially expand the tissue and prevent you from having to cut through the muscles in the back. So this does the least amount of damage to your intrinsic spine muscles. That's one of the problems you can run into after a big spine surgery is you might treat the stenosis, but the patient's left with a lot of low back pain. So typical candidate for this kind of procedure would be somebody who is got stenosis, possibly a little bit of instability, otherwise known as spondylolisthesis in the lumbar spine, and is not unstable, but to the point where the nerves are being impinged. So this is a treatment for patients with spinal stenosis and spondylolisthesis. So under x-ray guidance, you see the screw there is being placed and it goes between the spinous processes from the side. And then once the screw gets through there, you're going to see the deploying the phalanges there. And that's really what's going to create the fusion. So you got the device coming in laterally, fixating the two spinous processes, and then clamping down on the spinous process. So what you're effectively doing is spacing out that level, creating more room for the spinal nerves, and simultaneously fusing that level, so you are accomplishing fusion through a minimally invasive technique, an inch and a half incision. Risks of a procedure like this, obviously anytime you're doing something invasive, small risk of bleeding, small risk of infection. Risk of bleeding is always something you want to watch out for, so patients have to be able to come off of blood thinners. Afterwards, that's what the fusion would look like in place, and that's meant to stay permanently in the spine. Healing from this procedure, about 7 to 10 days for skin healing. Usually it's just a couple sutures at the skin incision. Again, this is the most minimally invasive approach we have to do a spinal fusion. Typically, I would offer this more to my older patient population where traditional fusion might be too much for them to handle. Long-term results, this is going to stay in place long-term. About 6 weeks for full healing of the bone and for everything to fixate. So I usually see patients a week after for a wound check, and then 2 weeks after to take out any sutures. And then 6 weeks is when I allow them to do full activity. But before that, you're up, you're walking around. This can be done with twilight anesthesia, and is a nice minimally invasive option for people who don't want to do a larger fusion. Hope this helps. If you have any questions, please feel free to put them in the comments.